I'm Patricia McGinnis. I'm going to be doing a physical exam on this patient. How are you today?
I'm good. How are you?
Good. Could you please tell us your name?
I'm Daniel McGinnis.
And Daniel, what day is it today?
It's Thursday, January 7th.
Great. And where are we?
We're in the pediatrician's office.
And what are we going to be doing today?
We're going to be doing my physical.
Great. Do you have any concerns or questions today? No. Is anything bothering you at all? Are you in pain anywhere? Your arms, shoulders, tummy, anything, any rashes, anything bothering you at all?
Nope.
Great. Okay. So I'll generally be starting at the head and I'll be working towards your feet. I may double back to some parts of your body, but we'll kind of go smoothly and I'll give you directions as we go for each particular body system that we're working on. Okay?
Sounds
so
good.
In the beginning, I'm just going to look at you. I'm going to look at your face and your head, and that's part of the inspection exam. Just looking for general symmetry. And if there's anything unusual as far as his head shape, I'm going to inspect your head. I'm looking at his hair, the texture and distribution of his hair, looking for any areas of hair loss, alopecia. I'm going to part the hair in different areas, just checking his scalp to see if there's any lumps, bumps, any rashes, any lesions whatsoever, any signs of infestation. Then I'm going to run my fingers across the scalp. Again, I'm feeling his scalp. I'm feeling for any hematomas, any unusual areas of his scalp, any areas which actually are painful for him. Does anything hurt you or bother you at all when I'm pressing in your scalp? Okay, you can put your head up. Great. Then the next part of the exam, just going to work down his face, and I'm looking at your eyebrows. I'm looking for symmetry, the hair distribution, looking to see if there's any rashes, any flaking, or areas where there would be any lesions. Looking at his eyes, the eye shape, his eye both to see if there's any of his eye droop on one side or not, the color of his eyes, his eyelashes, the distribution of his eyelashes, or if there's any discharge from his eyes at all. I'm going to be pulling your eyelid down, looking at the conjunctiva to see it's nice and pink, and I'm also making note of the sclera, that it's nice and white, there's no yellow color, no signs of jaundice. I'm also going to, hold on, I'm just pulling your eyelid up. Okay, great. Again, looking for the sclera of his eyes, the color, and noting if there's any jaundice or foreign bodies. Okay, now I'm going to feel your face. I'm just feeling your forehead. I'm palpating his sinuses, his frontal sinus. Am I hurting you at all? And then the maxillary sinus. Am I hurting you at all? No, great. Okay, next I'm going to feel his temporal artery. Again, feeling for symmetry and the quality of the artery. I'm going to feel his TMJ. Can you open and close your jaw? And can you move it side to side? Awesome. Does that hurt at all? No, great. Okay, then we're going to move on to more in-depth exam for his eyes. This is my ophthalmoscope, and I'm just going to, again, make note of the color of his eyes, and I'm going to look for pupillary response. I'm going to see how well the, actually the light went off in here, so I'm going to switch over, and I'm just going to use my otoscope here to check the pupillary response. So just look at my nose or the bridge of my nose, lift your head up just a little bit, okay? Just looking to see if his pupils respond. So when I'm looking at his left eye and I'm shining the light, I'm checking that his left eye is reacting. And then the second time I look, I'm checking that his right eye is also constricting. So the direct and conceptual response. Again, we're going to do the same thing on his right eye. Does it react to light? And then I'll be looking at the other eye to make sure that it reacts to light as well. Okay? Now I want you to follow my finger. So this time you're going to just look at the bridge of my nose and you're going to follow my finger. You're not going to move your head at all, only your eyes. Okay? So you're going to start here, and we're going to go this way, up, down, back, across, up, down, and to the center. And now I'm just going to come towards you and back again. Great. At any of those movements, did you have any double vision? No, great. Okay, so we're checking his extraocular movements and convergence. Okay, so at this point, I'm just going to switch, since the light, I'm going to switch and hope that it's the battery that is what is not working for the ophthalmoscope light. I'll just switch that out and see if we can get this perfect. It did work. Okay, so with this, Daniel, I'm going to be looking at your red reflex. So first just the corneal reflex of his eyes. Awesome. And then I'm going to come really in close to look at the red reflex of your eye and the background of your eye. So I'll be coming really close to you. Okay? All right. What I want you to do is look straight across. Just pick a spot across the room and just keep staring at that, even though I'm going to come really close to you. Okay? So just look straight across. And again, I'm going to put my hand on his head just to get some bearings, and I'm going to be coming in close. So again, getting that red reflex of his eye, coming in closer, looking at the different vessels of the eye, looking for any enlargement of the vessels and the background of his eye. So that we'll do on that side. And again, I'm going to do it on the other side. Look straight across again. Daniel, just straight across, looking at the red reflex, looking for any papilla edema, the background of his eyes, nice, crisp and sharp. So we're good with that. Awesome. Thank you so much. All right. Now, part of doing this physical exam today, prior to even starting the recording, I had measured Daniel's temperature, his respiration, his pulse, his blood pressure. I got his height, weight, and in the computer calculated his BMI. We did do his visual acuity with the Snellen chart that is in the hallway, and the hearing test where he had to raise his hand when he heard the beeps at different decibels to check his hearing. So doing the visual acuity is part of the visual exam already. Okay? All right. Next, Daniel, we're going to move to your nose. Now, again, for the nose, just looking for general symmetry, that there's no deformities, and inspecting to see that there's no discharge from the nose, no rashes or lesions. Okay? I'm actually going to look in your nose. I know it seems a little weird, but again, checking for any deviated septum, looking at the color of his turbinates, looking to see if there's any foreign bodies, any blood, or any lesions in his nose. Okay? Just tilt your head ever so slightly up. I use my thumb to lift his nose up, and I'm going to look on one side, and then we're going to look on the other side. Again, checking for patency and that there's no foreign bodies, lesions, that sort of thing. Okay, so Daniel, you can look at me again. Okay, now I'm going to check your mouth. We're looking at his lips. We're looking that there's no swelling, that there's no hepatic lesions. Again, there's symmetry of his mouth. All right, and then I'm going to have you open your, I'm going to switch this again. For some reason, the batteries seem to be giving us a hard time. So we're just going to switch this up. Oh, one more thing with checking of your eyes, actually. All right. I'm going to do what's called the cover and uncover test. So you're going to look straight at me, and I'm going to cover one eye, keep looking, and then uncover. Still look straight at me, cover one eye, and uncover, just to see if any of the eyes move in an unusual place. Okay? We'll do the visual fields later when we do the neuro exam. Okay. Next, we're going to inspect his mouth. I'm going to get a tongue depressor. This, Daniel's not to make you gag. It's just to move your cheeks off to the side. All right. Usually those parts up easily. It's okay. There we go. All right. So, can you open your mouth big for me, please? Can you open your mouth big? Look at me. Okay. Again, we're just looking for, tilt your head up just a little bit. General dentition. Okay. We're looking for to see if there's any caries, cracked, broken teeth, any loose teeth. We're checking for that. Stick your tongue out. Good. Say ah. Good. Looking for symmetry, that the uvula is in the center. Stick your tongue out again. Making note of his tonsils, if they're enlarged, if there's any exudate or petechiae on his palate. Lift your tongue up so I can look at the under part of your tongue. Okay, great. Now what I'm going to do is just open your mouth for me. Again, just feeling your inside of the mouth, right in here, and down under your tongue. That's all I had to do. Sorry about that. Okay? All right, very good. Okay, so now, again, sit forward and look at me. So again, we're going to check his neck. Again, with the neck, looking at the trachea, that it's midline, looking for any goiters, any enlargement. We'll check the arteries on both sides, the carotid on both sides. Great. I'm going to feel his lymph nodes now. Submental, we'll start with the submental, submandibular, tonsillar, feel the parotid, preauricular, which is in front of his ear, postauricular, behind the ear, and then we're going to go to the occipital lymph nodes, the posterior cervical, the anterior cervical, and then I'm going to feel the clavicular nodes. Awesome, great. Now, in Daniel's case, none of his lymph nodes are enlarged, but if they were enlarged, I would make note of where they were, the size, what they felt like. Was it rubbery? Was it movable? Is it red? Is it hot? Is it tender to the touch? The location of where the lymph node would be enlarged. I'll check the rest of the lymph nodes as I go down the body. So we'll check under his arms, the epitrochlear, and his inguinal nodes. But right now I'm just sticking with the head and neck. Okay, so I'm going to check, Daniel, if you can just kind of turn to the side. I'm just going to be checking, coming kind of in behind you a little bit more so your back is sort of facing me a little bit, because I'm going to be checking his thyroid gland. Okay, so again, with the thyroid gland, I'm coming in from behind him, just getting my landmarks. Great. Can you swallow for me? Wait, keep your head straight like that. Okay, awesome. Can you swallow for me? Great. And one more time, swallow. Perfect. Great. Okay, you can turn to face me again. Okay, we're going to do the ears because we skipped the ears. It's part of head and neck. And again, for the ears, we're going to first inspect, always inspect, and we're going to look basically for symmetry, if his ears are symmetrical and aligned, or if they're low lying at all. Looking at the outside of the ear, is there any discharge, crustiness, rashes, redness, anything like that? I'm going to do the tuck test. I'm just pulling on your ear. You tell me, am I hurting you at all by doing this? No. It's always good to know if the ears are hurting before you actually put something in the ear. Okay? Next, I'm actually going to look in his ear. Both I'm going to note the ear canal, if there's any edema or redness or discharge in his ear or cerumen, and also the tympanic membrane itself. So I'm going to look in his ear again, noting if there's any wax, looking for all my landmarks in the tympanic membrane, and that it's nice and pearly. Great. Again, we'll do it on the other side, looking at the tympanic membrane, looking for all my landmarks there, and checking the ear canal and making note of there's any wax or discharge or foreign bodies, which sometimes you find in younger patients who put things in their ears. Okay? All right, great. So that completes the head and neck exam. We'll do the other lymph nodes as we work further down the body. Okay? All right. And we'll also do the range of motion. Actually, we'll just go ahead and do the range of motion of the neck at this point. So Daniel, can you look at me? Okay, can you bring your chin to your chest? Can you bring your head back up? No, first, yeah, just head back up and turn your head to the side, one side and to the other side. Great. And can you bring this ear to your neck, to your shoulders, and the other side? So you can do this, or you could have the patient to the head all the way around, and that gets a good head range of motion of that. Okay, so now we're going to work down to doing respiratory and cardiac part of the exam. Daniel, if you don't mind taking your shirt off, that would be awesome. Thank you. I appreciate it. Great, thank you. All right, so again, we're starting with this part of the exam. We're doing the inspection, okay? So I'm inspecting his chest. I'm looking at, again, symmetry of the chest. I'm looking at how easily he's breathing, how well the chest is rising and falling, if he's using any accessory muscles to breathe, if there's any areas of deformities, any scars that might give us indication if he had heart or lung surgery. Also listening to if there's any audible noises like stridor, or audible wheezing if the patient is in distress. Sometimes even the position that they're sitting in can also give you an indication of if they're in distress or not. Daniel looks very comfortable. He is in no respiratory distress. So then I'm just going to palpate his chest. Again, feeling for any deformities, I mean, if he was a trauma patient, you know, you'd see if there was any trauma to his chest. And turn a little bit to the side so I can do the back as well. Okay, more so bring your legs up this way. Again, we're going to just, again, looking at the back, inspecting, just feeling if anything hurts. Daniel, you let me know if anything hurts. Just general palpating of the spine. We're looking at, if you can sit up straight for me, Daniel, okay? You're looking at the AP and lateral part of his spine and seeing the symmetry of his chest wall. Okay, I'm going to listen now. All right, Daniel, I'm going to listen to your chest. Every time I put the stethoscope on your chest, I want you to take a deep breath. Okay?
All right, sounds good.
All right. All right. So here we go. Big breath. In and out. In and out. Great. Awesome. I'm going to listen on the side. Great. And in the back. I'm also going to listen in the back. Big breath in. Now when I'm listening to his chest, I'm listening for how clear his breath sounds are, any adventitious sounds, like if he has some rales, bronchi, if he has wheezing. I'm going to percuss your chest, so this is when I just tap on your chest. Again. And turn, let me do it on the back. Again. And when you percuss, there will be different sounds, whether you're over a bone or you're in between the ribs or not. All right, I'm going to put my hands on your chest. We'll start in the front and then we'll go in the back. And when I put my hands on the chest, I want you to say the words 99. Okay? Go ahead.
99, 99, 99.
Great. We're going to do the back again.
99, 99, 99.
So we're feeling for tactile firmitas. It's not so important that he has it, but that it is symmetrical on both sides. Okay? All right. Now turn again towards me. That was the respiratory exam, and now we're going to do the cardiac exam. So part of the cardiovascular exam, again, looking for symmetry, looking for any signs of scarring or any signs that this patient is having any is in any distress. We're going to look at the neck, looking for jugular venous distension. Generally, we're going to check his extremities. We're looking for his color. And this is also part of the skin exam when you're just looking at general color and if the color is consistent with the patient's ethnicity, temperature. When we get to the hands, I'm going to look at his hand, feel his hands, check for any diaphoresis. I'm checking for cap refill. He has brisk cap refill. This part of his hands, I'm paying attention especially to his fingernails and his fingertips. Are they dusky? What's the quality of his fingernails? And now the next thing I need to have you do is put your finger together like this up in front here so that I could see. We're looking for any clubbing of his fingers, which is great. Part of the cardiovascular exam, if you uncross your legs, is the same thing, looking at his the skin, looking for the color, temperature, checking for any varicose veins. Danielle, I'm going to take your socks off because I have to check the pulses in your, thank you so much. Okay, great. So I'm going to check his radial pulse. You try to do the pulses together because you're checking for symmetry, amplitude, you're checking the rate. Gonna move up his arm. Great. We had checked the carotid, which you would only do one at a time. Okay. The popliteal, come a little forward. Actually, keep your leg bent, but come a little forward from the table. And again, this one is a little harder to find, but you're checking the pulse down there. You're checking the dorsalis pedis and the posterior tibial. Again, checking the color. You would do the same thing on this side. Great, awesome. Looking at his feet, checking the temperature, the color, cap refill down here. Here, I'm going to press to see if he has any edema, pitting edema, which he doesn't. So that would be part of the cardiovascular exam. Next, I'm going to listen to his heart sounds, okay? I will do this with him sitting up, and I'm going to do it with him lying down and then turning on his left lateral side. If you could sit up a little bit for me, okay? So when you're checking the heart sounds, you want to go to the second intercostal space, okay? On the right side, I'm going to check the aortic valve, pulmonic valve, it will be the second intercostal space, then working intercostal space 3, 4, and 5. That's the point of herb. The pulmonic valve, and then the fifth midclavicular line will be his mitral valve. So I'm going to be listening both with the diaphragm and the bell for all these spaces, and then I will have him lie down, and I will do it again, and then turn on his side as well, okay? I'm going to feel to see if I can find the point of maximal impulse. Also generally just seeing or feeling if there's any thrills, if there's any unusual feel to his chest. All right, we're gonna start again. I'm going to listen to his aortic valve. It's most clearly heard. Second intercostal space on the right, second intercostal space on the left, paying attention to his pulmonary valve, then just working my way down, third, fourth, and fifth intercostal space, paying attention to crested valve, and again, mitral valve, which is at the apex of the heart. All the while listening for any murmurs, gallops, the rate, is it regular, the rhythm, are there any murmurs? S1, S2. Again, I'm going to go back and listen with my diaphragm, the same areas for the various heart sounds. Making note of the kind of murmur, location, if it radiates, yes or no. Okay, I'm going to move my things, Daniel. I'm going to need you to lie down for me, okay? You could lie down for me, that would be awesome. Okay, again, same thing. I'm gonna check all those locations of his heart. Okay. Aortic, pulmonic, work my way down the area of herb, tricuspid, mitral. Again, turning it around, the bell. Listening for any murmurs, making note of rate, rhythm. Now Daniel has a very slow resting heart rate. He's an athlete, and his heart sounds are very clear, and he has no murmurs. Okay, if you could turn to your side just a little bit, your left side. And again, we're going to repeat and listen in all those areas again. Thank you. Perfect. Thank you so much, Daniel. Okay, great. Now let me feel his, the only pulse I needed to feel was his femoral pulse. Again, if you could uncross your legs, you want to feel the femoral pulse. If you have an absent on one side, that could be sign of a coarct. So you want to make sure that you feel the femoral pulses. Okay, next we're going to go right to your abdomen. Okay, if you can uncross your arms. And with the abdomen exam, again, the first part of the exam is the inspection. So again, just looking at his abdomen, you want to, is it concave? Does he have ascites? Is it distended? Are there any unusual pulsations, masses, lesions, anything that you can find unusual? Okay, so that's the beginning part of the exam, which was just be the inspection. I'm going to look it from above, and I'm even going to look at his abdomen from the side. The next thing I'm going to do is listen. You always want to listen before you percuss or palpate, and that way you won't interfere with your exam as far as listening for bowel sounds. You can stimulate peristalsis if you palpate first. So you're going to do it all 4 quadrants. I'm going to listen for bowel sounds. Just need you to relax, and you don't have to do anything special. Great. Okay. You want to make sure you listen long enough to hear bowel sounds in all the 4 quadrants. I'm just going to be tapping on your belly. just a general percussing of his belly. And I'm just going to do a light tap, a light pressing. Again, the first part is just a light palpation, okay? And then I'm going to go back and do a deeper palpation. If anything I'm doing is hurting you, you just let me know, okay? So part of doing the abdominal exam is trying to determine the liver edges, if the liver or spleen are enlarged, and finding the borders. So most of the liver is actually up under the rib cage. You can start down here. I'm going to start down here to percuss and kind of note where the noise where it changed, to track where it went from tympany to dullness. Daniel, I'm going to press down a little bit harder. Just try to let your tummy just relax, and just see if I can find the liver edge. Can you take a deep breath in, please? Okay, great. And it's one of the ways you can do it, to see if you can feel his liver edge. The other thing you can also do is, it's called hook the liver, where I do this, and again I press and try it again. Let your tummy just relax and take a deep breath in, and see if the liver will come down to touch your fingers, and you can feel the liver edge. We're going to try to feel the spleen, although for most cases you won't be able to palpate the spleen. It's way under here unless the spleen is actually enlarged. You can try to percuss, but again, often you won't feel the spleen because it isn't, unless it's enlarged. I'm going to just try again. Try to really relax your belly. Trying to feel for the kidneys. Again, bowels. Sometimes you'll find or feel some stool in the abdomen, way down here. If there's some tenderness, to consider appendicitis, or if the patient comes in and is complaining of belly pain, checking for any, if they have a hernia, umbilical hernia at all, you would do that. You could sit the patient up, if you could sit up for me, and just watch their muscles in the abdomen, and go ahead and lay back down, okay? I'm going to be feeling for his aorta, checking his aortic pulse, nice and strong there, great. And then you can come on either side and try to actually isolate the aorta to check for its size, okay? So this is all part of the abdominal exam. All right, next we're going to, if you can sit up for me, Daniel, okay? And turn your legs this way, we're gonna do the musculoskeletal exam. Again, it starts with the inspection. We're going to start with your hands, okay? And again, with the musculoskeletal, we're just looking at his fingers. We're looking if there's any deformities in the fingers, what's the color, what's the temperature, and we're going to do some range of motion. Can you squeeze my fingers real tight? Awesome, great. Okay, that's awesome. All right, next, what I want you to do is you're just going to bring your fingers down, just down and up, flexion and extension, okay? And then we're going to do your wrists, up and down, out and in. You can also have the patient doing a circle, okay? And again, checking the wrist. You're looking for, at all the joints, you're looking for if there's any swelling, deformity, redness, tenderness. Move to the elbow, the lateral aspect, medial aspect of both the joints, okay? And we're going to do range of motion of the elbow. If you can do, thank you. We'll come back to that. Flex and extend, pronate and supinate. If you can go back and forth, that would be awesome. Okay, one thing I did skip on your finger exam, okay? And we can do abduct and adduct. Okay, awesome, for the fingers. Okay, now we're going to work to, that's okay. We're going to go to the shoulder exam. The shoulder is actually quite a complicated joint. So there's a number of different tests you can do for the shoulder. Unless the patient specifically came in and complained of shoulder injury, we won't need to do all the different exams that you can do to check for a rotator cuff injury. But again, we'll start at the clavicle, work our way up. You want to make sure you check the entire, you palpate the full joint on both sides, okay? And all the while, Daniel, if I'm pressing or touching you in any way and something's hurting, you let me know, okay? All right, so Again, if you can lift your arms up, all the way up, go to the side, give yourself a hug. Awesome, great. You can also put your arms to the side and go this way and the other way. Great, awesome. Okay, next we're gonna go to the hip, okay? With the hip exam, actually, if you can lie down, that would be great. Lie down on your back first, okay? And for the hip exam, uncross your legs, Daniel. I need you to lift your leg up and put it down. Do the same thing with the other leg, up and down. Now I'm gonna lift your knee up and I'm gonna turn your leg this way, and you're gonna internal and external rotation of the hip. Again, this way and that way, internal, external rotation of the hip. I want you to bring this leg out, good. And then bring it up and across your body a little bit. No, straight. So kind of you're going like that, okay? So with the hip, adducting and then abducting goes across the body. Awesome. We're gonna do the same thing on that side. If you go away from your body, that way, adduct and abduct. Great. Okay, fabulous. Okay, then we're gonna do the knee and part of the hip before we move on. Just gonna press, looking for stability, any deformities or pain. Okay, if you could sit up for me. We're gonna work now. Swing your legs this way, please. Okay, again, knees, just doing the general inspection of the knees, palpating the lateral, epicondyle, medial on both sides. We're gonna check both sides. We're checking the patella. Generally, if there was an effusion, you would see it. It would feel boggy if there's any pain. So now what I'd like you to do is extend your foot, that one, and flex, back, great. That way and that way, great. The ankle, we're gonna look the medial malleolus, the lateral malleolus. We're gonna check the calcaneus and just all the bones, metatarsals and the feet. Again, medial, lateral, the calcaneus, all the bones generally in the feet and the toes, okay? Can you push your foot down and bring your foot up? Good. And then bring your foot this way and this way, and this way and this way. Inversion, eversion. Can you do a circle with your ankle? Let's do one at a time. Yeah. One way and then the other way. Great. One way and then the other way. Awesome. Great. And then with the toes, push down with your toes and bring your toes up. Bring your toes up. Great. Good. Okay. So that concludes the musculoskeletal exam, and we're going to just finish up with the neuro exam. Okay. So in the beginning part, we already assessed his mental status, so we don't have to go back to that. Okay. So part of this exam I'm going to do is check Daniel's reflexes and the cranial. We're going to check the cranial nerves. Okay. So we're going to do his reflexes first. Okay. So we can do this one first. Awesome, great. And then sometimes to flex your arm, let me just find that tendon. Great, okay, now just relax it right here, okay? And let's see, hold on, let me just press low. Okay, great. And then with this particular reflex, you want to have the patient have their arm just dangling and hold it, and then you're going to strike back here. Awesome, great. Okay, let's do this one on this side. With the tendons, you want to make sure that the brachioradialis, you want to make sure that you are checking for symmetry on both sides. Again, I'm going to check on this side. Just a little movement of that, and then here, flex your arm so I can find exactly where that tendon is. Okay, great. Okay, and then we're just going to strike. Great. And then again, right here, just let your arms relax and let me hold the weight. Okay, and we're going to strike here. Great. Awesome. Uncross your legs. We're going to do the patella tendon. Okay, again, just wonderful. Let's try that again. Great. Very good. And last one will be the Achilles. So with this one, if you can just bring your foot up just a little bit, we're going to strike back here. Okay, and he just a little bit of the plantar flexion, you will see. Again, bring your leg up just a little bit. Good. Try that one more time. Okay, awesome. So nice and brisk. Next, we're going to, so when you're doing reflexes, you're making note if they're absent, if they're hyperreflexive or hyporeflexive. Then I'm going to check his general, muscle. We're looking at his muscle bulk, mass, if there's hypertonia, hypotonia, and so just gentle range of motion, how well he moves with that, and you can make note of whether a patient is rigid or if there's any muscle spasms. Okay, now we're going to be checking muscle strength. Okay, so I already had you squeeze my fingers, but this time what I want you to do is bring your fingers out, and don't let me push them in. Okay, awesome. Now keep your fingers in and bring them out. Try to bring them out. Awesome, great, very good. Keep your wrists up. I'm going to try to push it down. Good. And on this side. Now this time you're going to go like this. First I'm going to pull you towards me, and then I'm going to push you away. Don't let me pull you towards me. Awesome. And good. Same thing on this side. Good. Push towards me. Elbows up like this. I'm going to pull your arms, push your arms down. Don't let me push your arms down. Great. Great. Okay. Now this time you're going to bring your leg up, and don't let me push it down. Bring your leg up. Good. This one too. Great. Okay. Down here, I'm going to push your leg in. You're going to try to pull it. Bring it out. Bring it out. Good. Now I'm going to try to bring it towards me. You don't let me. Great. Again, this leg. Bring it towards me. Now don't let me. I'm trying to pull it out. You try to bring it back. Don't let me pull it out. Great. Now this time I'm going to put my hands here. I'm going to push down. You don't let me push down. Okay? Keep your feet up. Don't let me push it down. Good. Now I'm going to push up. You push down. Great. Wonderful. Again, we're looking for his muscle strength. He gets a 5 out of 5. He's strong in all his body systems. Okay? Next, we're going to check his cranial nerves. The first cranial nerve is the sense of smell, which is the olfactory. Okay? In most cases, we don't check the first cranial nerve, but we'll do a cursory exam, of that cranial nerve. So what I'd like you to do, Daniel, actually you can open your eyes first, is just close one nostril and see if you can breathe out the other. Perfect. So you're just checking for patency of the nose. Now I'm going to have you close your eyes, and I'm going to put something under your nose, and I want you to tell me what you smell. Okay?
Sounds good.
Great. Okay. What do you smell, Daniel?
Alcohol.
Great. You can open your eyes. Okay? So that was cranial nerve number 1. Cranial nerve number 2 is the optic nerve. So this nerve is checked by checking his visual fields and through visual acuity. Prior to starting the checkup, I had checked his visual acuity with the Snellen chart in the hallway, and he was 20/20. So now we're going to check his visual fields. So this time, Daniel, what I'm going to do, and when we do visual fields, we have 4 visual fields. We're breaking his visual fields in quarters. And I'm going to put 2 fingers up. We can check 2 visual fields at one time, where I'm going to put my hands up like this. I want you to look straight at my bridge of my nose, and I want you to tell me how many fingers I'm counting. How many fingers I'm putting up, okay? Then I'll move them, and I'll do it again, and I'll want you to tell me how many fingers I'm putting up. Got it? Mm-hmm. Okay, all right. So how many fingers do you see?
3.
Great. How many fingers do you see?
5.
Great. So when you're doing this exam, when I had done this, and he said he only saw 2, then I know this visual field was absent, okay? And then we did the visual acuity already. Then we move on to cranial nerves 3, 4, and 6. We'll come back to 5. And these cranial nerves actually have to do with the movement of the eyes, okay? So this time I want you to look at the bridge of my nose and just follow my finger, okay? Don't move your head, just your eyes. We'll go up, down, across, up, down, across, and then again looking for accommodation. So we're going to do that, and we'll make sure that his pupils are equal and reactive to light. Again, we're checking on both sides and for consensual response of his pupils. Okay, the next cranial nerve is cranial nerve number 5. the trigeminal nerve. And there's two parts of this exam, or the testing for this. One is the sensory and the other is the motor, okay? So for the sensory, I'm going to touch your face. I want you to close your eyes, and after you close your eyes, I'm going to be touching your face, and I want you to tell me if you feel me touching on both sides or just on one side, okay? All right. Do you feel me touching?
Both.
Okay. Do you feel me touching?
Both.
And do you feel me touching?
Both.
Great. So with this cranial nerve, it's most well preserved in the middle, so you want to stay in the middle and not necessarily test on the sides, because you may not be testing the right V1, 2, and 3 because of the way they go. They're divided in the face, okay? And then the next one is the motor. So I want you to move your jaw side to side. Awesome. Great. Okay, so that was cranial nerve number 5. Now cranial nerve number 7 is the facial nerve, okay? This time what I want you to do is raise your forehead. Awesome, great. Close your eyes really tight. Don't let me open them. I'm gonna see if I can open them. Great, good. And then I want you to smile for me. Great. And frown and puff out your cheeks. Great. And I'm going to see if I can do that. Great. So that was number 7. 8 has to do with hearing. Okay. So what I'm going to do is I'm going to come close, Daniel, and I'm going to be, doing the rub test. So I want you to tell me, you can tell me with your fingers if I'm rubbing on, you hear it on your right, your left, or both sides. Okay. Got it? Perfect. Okay. Then we'll also do the whisper test. So I want you to occlude your ear on this side, and I'm going to whisper a word. You tell me what word I'm saying, and then we'll do it on the other side. Okay? Ready?
Yeah.
What did I say?
Say it again. Apple.
Great. Now occlude this side, please.
Baseball.
Okay, great. Apple and baseball, which is great. Okay, so that was the cranial nerve number 8. So now I'm going to check cranial nerve number 9, which is the glossopharyngeal. I'm going to have you open your mouth. You're going to say ah. I'm going to be looking at the back of your throat. So open your mouth, stick your tongue out, and say ah. Perfect. What I'm looking for is to make sure the uvula is in the center and that a soft and hard palate rise symmetrically. Okay, that was the glossopharyngeal. Cranial nerve number 10 is the vagus nerve. Okay, so for this one, Daniel, I want you to stick your tongue straight out and turn it side to side. Do it side to side. Great. Okay, this time I want you to stick your tongue out and don't let me push it back. Great. Do it on this side. Perfect. So that was number 10. Number 11 is the spinal accessory. I want you to bring your shoulders up, and you can bring them down. And this time you can bring them up and don't let me push them down. Perfect. Great. Very good. Okay, the last spinal nerve was cranial nerve number 12 is the hypoglossal. I just need you to stick your tongue straight out. Again, perfect. Just keep it out. Just lay it there. And you're looking for symmetry, that it doesn't deviate to the right or left. Perfect. So that concludes the cranial nerves. Next, we're going to do the sensory part. Actually, there was 2 parts of the reflexes that I didn't check. One was the superficial abdominal and the plantar. Can you just lie down for me real quick? We're going to just do the superficial abdominal and the plantar. Thanks so much. Thanks, Daniel. Just lay your head down. Okay? And again, so we're just gonna go like this, just seeing that his tummy contracts. Okay, great. Then I'm going to go to his feet, and I'm going to just relax your foot. I'm going to start from the outside, and from the inside, outside to inside. Great, perfect. Just checking that he should dorsiflex when I check that. Okay, you can sit up for me. Okay, great. Now for the sensory part, I'm going to use this Q-tip, which I'm actually just going to break in half, okay? And Daniel, I'm going to be touching from your ankles, your wrists, and your face. I'm going to touch you with both sides of this Q-tip. And sometimes when I'm touching you, just give me your head, please, or your arm. When I touch you, you're going to feel either that side or that side, right? This side is the dull, and this side is the sharp, okay? So uncross your legs. I'm going to start with your feet and ankle, and then we'll work up to the body. And you just tell me if I'm touching you with the soft side or the sharp side. Okay? Ready?
Yeah.
All right. Which side am I touching you with?
Soft.
Okay, great.
Sharp.
Great.
Soft. Sharp.
Great.
Sharp. Soft. Sharp. Soft.
Great. And we're gonna work up here. Good.
Soft. Sharp. 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 Soft. Sharp. Soft. Soft. Sharp. Sharp.
Great. Awesome. So that was checking sharp and dull. Now I'm gonna put, I need you to close your eyes and I'm gonna put an object in your hand, and I want you, without opening your hand, tell me if you can tell me what the object is. So open your hand, close it. Now, just by feeling, you tell me what object that is.
It's a key.
Okay, great. Very good. Okay. Now also keep your your eyes closed. I'm going to just write with the back of this. I'm going to write a number on your hand, and I want you to tell me what number I drew. Okay? Ready?
3.
Great. Okay, so these are both parts of the sensory exam, the graphesthesia and the stereoanalysis. Next thing we're going to do is, I'm going to, look at me please. First we'll do it with this hand. You're going to point your finger, and we're going to do it with this hand first. You're going to touch my finger, and then you're going to go back to your nose. And everywhere my finger goes, you're going to go to the finger and then the nose. Okay, point your finger to nose, finger to nose, finger to nose, finger to nose, finger to nose. Okay, with this hand, same thing. Finger to nose, finger to nose, finger to nose, finger to nose. Great, very good. Now I'm going to have you close your eyes, and I'm going to be touching you. So like I might touch you here. I'm going to have you open your eyes and you tell me where I touched you. Okay, so close your eyes. Where did I touch you? Great. Close your eyes. Where did I touch you? Awesome. Close your eyes. Where did I touch you? And where did I touch you? Good. We're looking for a point location. Okay, now we're going to check your coordination. So this time what I want you to do with one of your hands, you're going to take your hand and you're going to back and forth, faster and faster. But you have to lift it up and change it. Lift it up and change it. Great. Awesome. Nice and steady with his movements. Now you're going to switch hands and do it with the other hand. Back and forth, back and forth. Great. Awesome. So again, we're looking for that his movements are nice and fluid and smooth. Now with your fingers, with this hand, I want you to go from, you're going to touch your finger to thumb, this 1, 2, 3, then go backwards. Okay? Perfect. Now same with this side. You're going to go backwards and forwards. Perfect. Perfect. Again, these are looking at his coordination. This time what I want you to do with this heel, you're going to touch just under your knee down to your foot and back up again. Great. And then you're going to do it with the other one. Down to the foot and back up again. If he had cerebellar ataxia, he would have a hard time with this, and even the finger to nose, he would have a hard time finding where the finger was. Okay. Now, the next things I want you to do is you can stand up for me. If you could just take a few steps forward. Great, and back. Awesome. And this time when I want you to walk in a straight line where you're going to let the front of your foot, the back of your foot, and you're going to walk in a straight line. Perfect. These are all looking at his coordination. This time when you come back, I want you to walk on your toes. Great. And then turn around and walk on your heels. Great. Okay, and then come stand in the middle of the room and just do a shallow knee bend. Just a shallow knee bend. Good. Awesome. This time you're going to stand with your feet together, and you're going to have your arms by your side, and I want you to just close your eyes. Again, I'm looking for if he is able to balance. When part of balance, you have to have 3 parts, is vision, your vestibular, and your proprioception. If we take, you have to have 2 of them. So we took 1 out. We took the vision, and he's still able to balance. Great. You can open your eyes. This time what I want you to do is hold your arms straight out with your palms facing forward. And then when I tell you, you're going to close your eyes. And then I'm just going to hit your hands rapidly. And I just want you to maintain your balance. Okay? Go ahead and close your eyes. Perfect. So when I do that, the pronator drift, the patient will bring their arms straight up to where they were. So Daniel, I have to check the lymph nodes under your arm, and then I'm going to check your spine and your range of motion of your back. okay? Because we didn't do those when we did the other parts of your checkup, okay? So I'm just gonna feel under your arm. Just relax your arm a little bit, and feeling under here, and again on this side, and we're feeling under there. Okay, if you could stand up for me, just stand in front of me. Great. So in checking his here, just no, turn forward just like that, okay? So here, when we're checking his spine, I'm gonna start at C7, and I'm working my fingers down on checking each vertebra, and basically they should be nice and even and smooth, and I shouldn't feel any areas that go in or especially go out, any step off points. At any point, is anything that I'm touching you hurting? Okay, and then I'm going to check the muscles on either side of his spine again. There we go. Okay, and while I'm here, I'm going to be checking for, again, we're looking for general symmetry and looking at the curves of his spine, and I'm going to be checking range of motion. While I'm here, I'm going to be checking for scoliosis. When you check for scoliosis and just look straight ahead for me, you're looking at, the patient should have equal shoulder heights. I'm looking at his scapula and his hip height, and that the hip height is even. If he had an uneven hip height, that could be a sign of leg length discrepancy. Daniel, if you could just bend straight over, like you're going to touch your toes. And I'm going to look straight across to make sure his spine is nice and straight, and that his scapulars are even. And if they weren't, that could be a sign of spinal rotation. Okay, you can stand back up. Okay. Now this time, what I want you to do is bend backwards towards me just a little bit. Perfect. Now straight. Okay. Now bend to the right side, and bend to the left side. Great. Now twist. Keep your bottom body. Yeah. Twist to your right, and twist to your left. Perfect. Great. Okay. You can have a seat. Thank you, Daniel, for participating today. I appreciate your help in completing this physical exam. And do you have any questions or concerns? All right, great. Thanks so much.